Good afternoon, everyone. Thank you for joining us today. I'm Faith Colas, Director of Advocacy, Outreach, and Community Affairs. On behalf of Dr. Eve Hall, CEO and President of the Greater Milwaukee Urban League, welcome to Conversation Wellness. This is a series that will inform you and keep you connected to the ongoing work of the Greater Milwaukee Urban League and the work of our community partners. The Conversation Wellness series is part of our mission to address inequities and covers a wide range of topics, including but not limited to health, home ownership, employment, financial empowerment, education, entrepreneurship, voter education, and family. It is our goal to empower communities and change lives. Before I begin introductions, let me remind you to mute your microphones unless you have a question or comment during the presentation, and then our guests can address your question or comment. Also, feel free to comment or submit a question in the chat box during the conversation as well. We will be recording today's series, so if you have to leave us for any reason or you want to share today's session with others, we will be posting today's presentation on our website at tmul.org, on our social media, as well as our YouTube page. Today's Conversation Wellness is focused on sickle cell disease and is sponsored by our friends and partners at Humana Eye Care. September is Sickle Cell Awareness Month, and joining us is our community partner presenter, Elodie Antala. She is a patient advocacy liaison to Versity Incorporated in the Community Outreach and Advocacy Office. Her role is to establish trust, increase diverse donor population, and bring visibility to Versity's mission in communities of color. Elodie focuses her work on building partnerships to bring awareness and education to community members and patients they serve. She works across functions inclusive of the blood services, donor recruitment, and diagnostic labs to promote and advocate for those living with sickle cell disease. Shortly, you will hear from Elodie. She has co-authored the American Society of Hematology Sickle Cell Disease Treatment Guidelines and currently serves as a National Community Advisory Board member for ASH Research Collective. She is a patient advocate on sickle cell data collection project through the Centers for Disease Control in collaboration with the Medical College of Wisconsin, and is part of multiple community-based organization work groups providing insights on patient care, treatment protocols, and advocacy for patients with sickle cell disease. Elodie is a sickle cell patient who has dedicated her time to advocating for people living with sickle cell disease by participating in and conducting research, facilitating focus groups, and connecting patients to community resources. She continues to expand her commitment to this community by being a champion of equity and patient rights. She holds a master's degree in sustainable peace building and a bachelor's in global studies from the University of Wisconsin-Milwaukee. She speaks 4 languages, although she will be speaking to us in 1 today, and her work has included economic and social development in the United States and abroad. Elodie, welcome, and we thank you for joining us today. The virtual floor belongs to you.
Good morning, everyone. Thanks, Faith. I'd never heard my biography being read so eloquently. You're making me sound so cool. I'm not.
You are so cool.
Thank you so much for inviting me today. I'm really excited to be able to present on the work that we are doing at Versity in terms of blood advocacy. And today is almost the last day of Sickle Cell Awareness Month. But as we know, this disease is all year round and affects people all year round. So we will continue the work every day. Zainab, please, if you can So I will talk a little bit today about why we need ethnically diverse donors in our communities. And I will share a little bit of my story in terms of why I am such a fierce advocate for the disease and how it has affected me. Next slide, please. Next slide. So Versity has made a commitment to really addressing the needs of our communities. And one of those needs that we've identified is that people of color in underrepresented communities continuously do not have access to care. We have made a commitment to provide education and awareness and support in these communities, especially as it relates to blood donation and sickle cell disease. While sickle cell disease is considered a rare disease, it affects, in the Black community, in the Black and Brown community, it's really prevalent. It is, sorry, so it is a disease that affects mostly African Americans, and 1 in 365 African American births in the US will have sickle cell disease. And then again, overall, 38% of the general population in the US are eligible to donate blood, but less than 10% do so annually. So when we really talk about our target audience for the education and awareness that we do with the community outreach and advocacy group is really to engage the communities that, again, are underrepresented. We know that we understand that the reason why certain communities are not engaged is not because they don't want to, it's because of lack of understanding, lack of access, and lack of resources provided to them. Next slide, please. So sickle cell disease is a blood disorder that affects the red blood cells. So as you can see in the picture, we are all born with normal red blood cells. There's a protein called a hemoglobin that's on the red blood cells, and that protein is there to carry oxygen through the body. A normal red blood cell is round, filled with oxygen, and it's malleable. It is able to travel through our blood vessels and, again, carry oxygen throughout our whole body. A patient with sickle cell disease has that sickle cell shape. So they're able to create a round cell, but then it becomes sickle. And when the red blood cell becomes that shape, it is not able to carry oxygen through the body. And it also creates blockages in those blood vessels. And when those blockages take place, it results in pain crises, organ damage, stroke, and the list goes on. The effects are really, really terrifying. It's a genetic disorder, so both parents will have to carry the trait, this hemoglobin S trait. That's what creates the mutation in the red blood cells. Next slide, please. In the United States, there are 100,000 Americans. Again, one out of every 365 Black or African American births will have sickle cell disease, and 1 out of every 16,300 Hispanic American births will have sickle cell disease. One of the things that we really try to do as part of our education is to encourage people in these communities to know their sickle cell trait status. So understanding if they have sickle cell trait or the disease will allow them to do some family planning to understand what it means to have sickle cell trait and to understand what it means if they were to have a child with a person who also had sickle cell trait. This test we have newborn screening and that can take place, but sometimes, most of the times, a lot of people in our communities really don't know their traits. And so you'll find more people with sickle cell trait. It's a blood test to find out how you have sickle cell trait. You can ask your primary care doctor to get that test done for you. So we really do encourage people. I know that the clinics here in Milwaukee who focus on sickle cell tend to have a program that encourages people to know their traits, both the adult and the children's clinic. Next slide, please. So sickle cell disease really mostly affects people with African ancestry and around the world where malaria was present or is present. So as you can see on the map, most of sub-Saharan Africa, South America, and then Asia and East Europe. There are different forms of sickle cell disease. So there's there are different types. They're called SS, SC, and beta thalassemia, and those types can be found. Some of the sickle cell types can be found mostly in Europe and Asia, but it affects people differently, and they're all just as devastating. Next slide, please. So sickle cell trait versus the disease. You have a sickle cell gene. It's hemoglobin S. Some people experience complications with it, not too many. Some people develop later in life issues, but there isn't any anemia. And some people live completely healthy with no issues with sickle cell trait. With sickle cell disease, you have both of the S hemoglobin. And again, like I mentioned before, it causes anemia, pain, strokes, organ damage, and a lot of different things. And people experience this disease really, it varies how people experience the disease. Next slide, please. In terms of treatment, when a patient is really severely ill, blood transfusions and blood exchanges is really common. And that's because we know that it is a blood disorder. So if doctors are able to remove the sickled cells and able to transfuse the patient with donor cells and provide more oxygen to that patient's body, that's really helpful to the patient. Oxygen is able to be carried throughout the body. So that's why blood is really, really important for this disease, and why we at Versity really encourage blood donation for this disease specifically too. A lot of patients take opioids for pain management. There is a stigma around this because the majority of our patients are African American. And so when they are seen in clinic or the emergency departments, the first thing that comes to mind is they are drug seeking and that they are they really are not sick, or that their pain is dismissed. They cannot be as sick as they are showing. So it's really difficult for sickle cell patients to get care, especially in the ER, because of all the stigma around the disease, but also because it's sort of it's racially charged because most of the patients are Black. Hydroxyurea is a medication that's taken every day to try to manage that hemoglobin S. And then there's a list of new medication that has come on the market that's helping different patients with different symptoms. There is a cure for sickle cell disease, bone marrow transplant, and now the NIH and all across the country, and even right here in Milwaukee, bone marrow transplant and gene therapy and gene editing are being researched and done. It is not accessible to everyone yet because some of these things are in research phases. Again, Black and brown people don't tend to be donors of blood, so it's really also hard to be donors of marrow. So patients don't have donors that match them closely. So it's not really accessible. So we're hoping that with more research and more development with gene therapy, that there's more access to that cure. But right now it's not widely spread out, although the clinics here in the state have made commitments to this cure. And I know I personally have gotten the cure. I've reached my 1-year mark, so I don't have sickle cell anymore. And that's due to the work that's being done here in Milwaukee. And I'm very grateful for that. But so the work is ramping up, and excited to kind of see to see how it continues to grow and help the patients that are living in our state and across the world. Next slide, please. I was going to pause here just to give you a quick summary of my story. I was born with sickle cell disease. My parents both had the trait. Of 25 cousins and a million aunts and uncles, I am the only person in my family on all sides that has this disease. So I guess I was the chosen one. It's very debilitating, lots of days and nights in the hospital, missing school. And I have had a stroke and lost vision in my right eye. I've had several surgeries, and finally, about 4 years ago, I was placed on those exchange therapy transfusions. So every month I was getting 8 units of blood that really allowed me to have a quality of life. Prior to those blood transfusions, I was on hydroxyurea. While it improved my quality of life, it didn't really prevent things like strokes and continuous organ damage. So after 4 years of being on these on these exchange transfusions, we were presented an option to go through the bone marrow transplant here at Frederick. And while it was a very difficult decision to make, I was blessed enough to have my dad be my donor. And like I mentioned earlier, it's been a year since I went through the process, and I wouldn't change a thing. I am so happy that I went through the transplant. I feel 100 times better. It is something that I wish that could be accessible to everyone who has this disease. So that is why I'm such a strong advocate, and because I know that we can do it. The cure exists. It just requires a lot of research, time, and commitment, and money to get this done. Next slide, please. So I I wanted to talk a little bit more about just blood because that's what we do at Versity, and it's something also that I'm passionate about. So when we encourage people to donate blood, it's because we know that 51% of African Americans and 57% of Hispanics have type O blood. And that's the blood type that's mostly needed in trauma situations. The fact that O negative is the universal donor, those are all necessary. In addition to that, we know that we have the ABO/AB blood types. What's even more interesting about these blood types is if you have a plus sign, what's called an Rh positive blood type. So if that means if you have a plus sign next to your blood type, there's more testing that's done. There's more antigen testing that's done, and we figure out if you have another subtype and how rare your blood might be. You can go to the next slide, please. And that that rare blood type, or uncommon, I should say, uncommon blood type is called RO. And this RO subtype, Rh positive blood, is mostly used for treating sickle cell patients. So a patient like myself who used to receive 8 units of blood every month, that requires about 20 donors to donate blood. But because a patient is receiving that many units, we want to make sure that that blood unit is matched completely and as closely as possible, so a patient does not experience any rejection or any complication. This specific blood type is found in 44% of African Americans and 17% of Hispanics. Our current blood population, there are only 4% of people who carry that blood type, and the need is really, really, really big. So we try to really encourage and provide this information all over our community to say, while we understand we understand the situations in which people are in, but we also want to try to find a balance in how we provide resources, but also really drive home the fact that we need each other, especially with this RO blood for sickle cell disease. Next slide, please. Like I mentioned, one patient might need 8 to 10 units in one day, and that requires about 20 RO donors for that transfusion to be successful and helpful. So we really encourage people to donate blood. Um, RO definitely can be found in other ethnicities, but it's just to show the prevalence in Hispanics and African Americans. So currently, the majority of our RO donors, the majority of them are Caucasian, and so we're trying to really change. We're really trying to encourage the majority of the people who that specific Rh positive blood type might be found in to donate blood. And no, RO does not mean you have sickle cell. It just means you can help somebody who has sickle cell disease. Next slide, please. So matching makes all the difference. And ethnicity does matter in terms of matching, because there are different types of antigens and proteins in our blood that are certainly found in certain ethnicities and not in others. And so for every person who will ever need blood in their lifetime for any reason, sickle cell disease, pregnancy, trauma situation, car accident, gunshot wounds, anything, we want to make sure that that blood matches the patient as closely as possible. And so when we talk about RO, that's one of the markers that indicates how closely a blood unit will be matched to a sickle cell patient, because the majority of our patients in the US are African American. Around the world, obviously, like I mentioned earlier, it's not necessarily a Black disease. It's just that in the US, the majority are African American. So we try to really match it as closely as possible. We want to prevent any damage. We want to prevent any rejection, and we want to make sure that that patient walks out feeling healthy and with more energy, and it enhances that patient's quality of life. Next slide, please. I'm almost done. And then this is just my call to action. You can prepare to donate blood. It takes about an hour. You bring your photo ID before you come to donate blood. Drink a lot of water, eat some fiber, eat some protein, relax before and after. But it's a really simple experience, and 1 unit of blood can save 3 lives. And so your time is really impactful when you donate blood. Next slide, please. These are just to address some concerns that people may have when they're donating blood. It is safe. We don't draw your blood if you have a low hemoglobin or low iron. There's no risk of being infected with HIV or anything else for that matter. Everything is sterilized. It is a medical environment. And if for any eligibility concerns, we walk through that with all donors. So it's really easy and safe, and any questions or concerns can always be talked through, but we really work really hard at Versity to make sure that our donors are well served, so that we can have some impacts on our patients' outcomes. Next slide, please. I think that's it. Yeah, so I thank you for your time today. It's still Sickle Cell Awareness Month, and even beyond, if you can, you should donate blood. I am very blessed to be here with you all today to tell you my story and encourage people to donate blood and bring some awareness to this very debilitating disease. Thank you.
Elodie, thank you so much for that very informative presentation. A couple questions I have. If people are interested in donating blood, how can they do that?
Versity.org. And then there's a big red button that says donate now. And all it requires is for you to type in your zip code. Also, If you are going to be at Sister Strut this Saturday, we have a blood drive going on. We are accepting anybody who wants to do a walk-in. So we'll be there with our mobile unit at Sister Strut this weekend on Saturday.
And let me ask you this, LOD, if people want to know their blood type, I still don't know my blood type and I'm way past 60. How can I find out my blood type? If I donate blood, would I be able to find out my blood type?
100%. If you donate blood, you will find out your blood type. You will find out if you are RO. And we also find out if you have a rare blood type. Fun fact, we are running a research project where we're identifying RO donors and rare donors, and all it requires is a cheek swab that goes to our lab. And once you get the cheek swab done, we'll test your genotyping, and we'll tell you what your blood specific markers are, but we will encourage you to come and donate blood. So you can do a cheek swab with me at an event if you find me at an event, and I have my cheek swab kit there, and that goes to the lab. But donating blood is the quickest, easiest way to find out your blood type.
There was something in your presentation, Elodie, that I wanted to ask a question about. You mentioned it early on about the normal blood cell, what it looks like, and then what a sickle cell blood cell looks like. So my question is, do we all start out with a normal blood cell and then it sickles, or do you have a combination of those?
As I understand it, it's a combination of both with sickle cell disease. So your marrow creates the hemoglobin, and then the blood cell dies quicker than the normal hemoglobin. I think it's a sickle cell blood dies in like 21 days versus 100 and some days for a regular blood cell. So there's a big margin there. But yeah, I think it's dual, but I need to check my sources on that one.
I think for everyone on the Zoom, it's a good question. It was the way that I was looking at the diagram and I saw the normal cell and then I saw the sickle cell, and then I wondered if they're combined, because this leads into my next question. Are babies tested, newborns, when they're in the hospital? Are they tested for sickle cell?
Yes, so there is newborn screening happening now all over the US to identify whether or not your child has sickle cell disease. So part of the sickle cell trait campaign that a lot of advocates talk about is that we try to encourage people to find out before they have children, not to deter them from having children, but just to be prepared. And so if they know that they have sickle cell trait and that their partner also has sickle cell trait, then they'll know that there is a 25% chance for their child to have the sickle cell disease. And then will be tested. The child will be tested.
And do you know if that is a mandatory test that happens, or do parents have to ask for that test?
It is a mandatory test. It became mandatory in the 80s.
Okay.
Yeah. So, but most people still don't know. So if you still don't know, we encourage you to ask your primary care to get your blood tested.
And I do have a distant cousin. I think she's second or third cousin. She's no longer with us. She passed away during childbirth, and she had sickle cell. I was in high school, and so she had to be in her early 20s. But we never had a conversation in our family about, sickle cell or what my cousin, went through. And then when I became a mother, I never asked for, my daughter obviously had tests. They may have told me and I just don't remember, because she hasn't had any problems or anything like that. But I just wonder how prevalent it is and how knowledgeable African Americans are to even ask.
Yeah, so that is one of our challenges with sickle cell disease. It's not talked a lot about. There is a lot of stigma around the disease itself and how it affects people. And then the people themselves who have the disease have difficulty getting through life, especially from transitioning from a child to an adult and having to navigate life and work and missing work and having your employer not understanding why. A lot of sickle cell patients are on Medicaid because they qualify for that disability marker on Medicaid, just because of how debilitating it is. And it wasn't really talked about from me growing up until now. I do understand there are some people who say that maybe in the 60s or in the 70s that the US had a lot of public health campaigns about sickle cell disease, but again, it's not really talked about and it's not really accepted. So we want to bring light to it, bring awareness to it, make sure that caregivers know how to provide care with compassion and love, but also take care of themselves, make sure that the patients have the resources and know the facilities that they can access through to get their care. All of that is really important to the patient's care and their family's care, because it affects everyone. When someone has when someone has sickle cell disease, it affects every single person in the family. Yeah.
Well, again, to our guests who have joined us this afternoon, this morning, if you'd like to donate blood, if you'd like to host a blood donation event, just visit versity.org to do so. I want to thank you, Elodie, for joining us this morning. I also want to thank our sponsor, Humana Eye Care. This presentation will be on our YouTube channel, our website, tmul.org, as well as on our social media. We also want to remind you before we go, okay, that November 8th is election. And if you're interested in volunteering to get the vote out, join our Reclaim Your Vote campaign by following us on Facebook or giving us a call at 414-374-5850. Also, for election information and any voting questions that you have, please visit myvote.wi.gov. And again, we want to remind you that our next Conversation Wellness will take place on Thursday, October 13th. And we will be talking all things related to COVID-19, monkeypox, the flu, and shingles vaccinations. We get to give you a lot of time back today. So I want to thank you for joining us. We'll see you soon and have a wonderful weekend.